what has it been like for you to live with CIRS?
Yes, I appreciate you asking that question, because part of the reason we've created CIRSLab, the platform, is to empower other patients by telling the story of CIRS and, you know, what CIRS is, how do you get out of it, how you go back to regain your sort of normality in your life. And so that's one thing that I want to do over time, is to share my personal story.
Mm-hmm.
And so my story is much like many other CIRS patients. I had a relatively normal life throughout my teenage and young adult years. Though there were subtle signs here and there as I grew up. And eventually I hit what I call a point of no return, which is what happens with CIRS patients at some point in their lives. And my entry point was the gut. And it is the entry point for a lot of patients with CIRS. About 8 years ago, I started having sort of more notable gut issues and food intolerances. And they got progressively worse, and eventually I was diagnosed with pancreatic enzyme insufficiency, which is the idea that your pancreas stops producing digestive enzymes in order to break down foods like a normal person. So this was before I knew anything about CIRS, right? So I'm just kind of setting up the stage. So I started treatment for that, and that seemed to have brought me back to normal. And this is very common with CIRS patients. Over time, they may experience episodes where they kind of go into it and then they come out of it. And they can't quite figure out what it is, but that happened to me a few times, and this was one of those. But then in 2020, something completely changed in my body that I had never experienced before. It was like a qualitative change. My digestive issues came back. They were worse than ever, actually. I started developing symptoms associated with gastroparesis, so a slowdown in motility that was really weird, which is connected to the nervous system, you know, directly. But the symptoms were not only digestive. I started to develop a long list of unexplained symptoms, severe anxiety and PTSD-like symptoms, loss of taste and smell, heart palpitations, memory problems, slurred speech, vertigo, which I know is a big one in your group, weird leg cramps. So all of these symptoms that you would say, what's the relation between them? I started to develop neuropathy in my right foot. I lost about 50 pounds within 6 months, all the way down to 100 pounds, and I'm about 5'8", so just to give you an idea. And another symptom that I thought was to me the scariest symptom was frequent urination at night. And at one point, I just, no matter how much water I drank, I spent an entire day just urinating the entire day, and I ended up after that in a wheelchair for about a month. So I couldn't walk, I just couldn't do anything. And at that point, you know, I'm thinking, oh my God, what the hell is going on here?
Right.
But then I noticed that a lot of these symptoms were triggered whenever I went to certain places, walking by certain buildings or entering certain grocery stores. So I started to kind of pick up on this pattern, but I didn't understand what was going on. This is all before I really had an understanding of CIRS. And I had been to so many doctors. I spent a fortune of money doing tests, MRI, CT scans, endoscopies. Nothing came back, really. I even tried doing cognitive behavioral therapy for my PTSD and anxiety. And even the therapist couldn't figure out the pattern. They were like, you kind of have a profile that looks like a PTSD patient, but you don't have the trauma that we typically see with the event. So they could even tell there was something weird. And it was very frustrating, and this is usually the case for CIRS patients. Eventually, I ended up working with a functional doctor. We were trying all kinds of functional treatments. They kind of helped me, but it wasn't quite getting me where it was supposed to be getting me to. Like the expectations of a lot of these treatments, they weren't really being fulfilled. And this is like over time how my functional doctor started suspecting I may be one of these CIRS patients. He didn't know much about CIRS. He just knew enough to tell me this thing is out there. Maybe you want to get yourself in touch with a doctor who treats this illness. So I spent the next several months just reading everything, you know, like you said, obsessing about the literature, because I realized that there was an entire scientific literature that could explain all these symptoms And even more fascinating, that there was a protocol that could reverse everything back to normal. And I was like, how is this even possible? So eventually I got paired with a practitioner and I started treatment at the beginning of last year. And just to give you a quick summary, I'm about 75 to 85% recovered, roughly speaking, since I started that treatment. I still haven't finished treatment, but I'm at a point where I'm able to do this kind of lovely live stream with you and enjoy it.
Yes, we're so thankful to have you. And I think it's really interesting you mentioned just from a mental health perspective, because obviously that's my area of expertise. Now that I've learned about this, now that I've experienced this myself, there are certain patients that I work with, and it seems like we're throwing everything at it. They're getting benzodiazepines and strong antihistamines and all these things, and it's like the vestibular symptoms are still really severe. The anxiety, the panic is still really severe. And in my head, that's when I'm thinking about like, there's a bigger force going on that's preventing this person from being able to benefit from these treatments, whether it's medication or these behavioral interventions. And that's when I really start honing in on like, we need to get this person to the right type of provider to see what else might be going on. So what would make someone suspect that I just mentioned some things like maybe treatment's not helping or feeling like you're kind of plateaued, and maybe you've made some progress, but you don't feel like you're able to get well. So what would make someone suspect that they might have a chronic inflammatory response syndrome going on?
Yes. So I think, I think the big one usually is trying every treatment that you can think of and you don't see any improvement. You should be able, a normal person, for example, a normal person who gets a Lyme infection, they undergo treatment for a few weeks or a couple months, and their symptoms should resolve, right? That's not what happens with CIRS patients. They do the treatment, and they may get better, but then a couple months, they go back as if they had the infection. And in fact, they get the infection treatment, and it doesn't do anything. So if you have anything like that, you go through an infection, you go through sometimes actually traumatic events are associated with onsets of CIRS. So if you have any kind of very unusual experience, then you go through the treatment and you just don't see the recovery that you should be seeing, because we should be seeing recovery with these treatments. You start thinking about CIRS. That's like one of the red flags. And within that, you can have situations like extreme diets. A lot of the people with CIRS end up doing extreme elimination diets. A lot of them are going to end up being carnivore dieters. And what's really interesting, I've seen this a lot, where you have people who are very strictly doing carnivore diet, and they still have glucose problems in their blood. They have all these weird metabolic problems that shouldn't be happening with that diet. And it's because it's not about the diet, it's about this abnormal immune response that has shifted the metabolism into a battleship mode, and it's completely changed it.
One thing that stands out for me that I noticed in myself and a lot of patients that I work with is extraordinary sensitivities to everything, to food, to medications, to supplements. Like even one drop of something new can send someone into a major flare. For me, that's a big kind of red flag too.
It is a big red flag. If you have hypersensitivity, so they may start out with foods, and eventually they start transitioning into fragrances, chemicals, odors, all these things. And we now know that there are actually genes that we can measure that turn on. They're called the CIRS genes. That once they get triggered, people start activating these kinds of issues with multiple chemical sensitivities. And even with supplementation, they become hypersensitive. I was one of those people. I was like so sensitive to just about anything in my environment. And I mean, it comes to a point where you realize, well, of course you're gonna have anxiety because your nervous system is in this like extreme sort of mode of hypersensitivity that you're not supposed to be experiencing. So yes, that's a really good point or example of how to think about CIRS. And then with that, if you ever start picking up on the pattern that whenever you go to someone's house or you walk past by a certain street and you kind of feel a little bit dizzy, you feel a little bit fatigued, and you've been having already a history of some weird chronic symptoms, that's also something that's very common with CIRS. And in some patients like me, I basically had to learn to avoid walking around so many places because it's like every corner would trigger different symptoms when I was really sick. And yeah, and so these are